A true shoulder dislocation is not subtle, so when your shoulder comes out of place, you will typically know this right away. This frequently occurs from an injury or loose ligaments in the shoulder joint, and there are a few signs that you'll often notice. Dislocating your shoulder is painful. Your shoulder may visibly look like it's out of place or have a deformity, and you'll also likely experience limited or loss of motion in that shoulder and arm, or sometimes a dead arm feeling. Most people in this situation will have had either a dislocation with a spontaneous reduction or what we call a subluxation. In a dislocation with spontaneous reduction, the shoulder comes completely out of place, though simply pops back in on its own, versus a subluxation where the shoulder is only partially dislocated and stays in place on its own. The difficulty for patients is that either of these injuries can produce significant damage to the joint that may indeed require further attention from an orthopedic specialist. Roughly half of patients that dislocate will not experience a spontaneous reduction. This is often referred to as a locked dislocation, which means the shoulder cannot be put back into place on its own. Unfortunately, in this case, it's time for a trip to the ER to have the shoulder relocated. If your shoulder suddenly hurts, looks out of place, and has limited motion, you may have dislocated your shoulder. It's time to see a UCHealth CU Sports Medicine orthopedic specialist to be evaluated for the best treatment for you.